What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, RSV, or some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, December 4th, 2024. If you're new to my channel, welcome to my channel. You've clicked onto the channel where we do updates on all the viruses that can make you sick. Let's face it, there's a lot of viruses out there, and you need to be informed with what's going on with these viruses. That's where I come into play. I started doing this a few years ago. Used to be daily. Now we do it 2 to 3 times a week. This week will be 3 times because there's a lot of news this week. So, want to stay informed with what's going on? Just hit that subscribe button down below. Give this video a thumbs up. Hit that notification bell, share this video with anyone you know, and leave your comments down below. Alrighty, today we do have several news stories. Then we're going to take a look at some data, which includes Walgreens, wastewater data, New York State. We do have something from Pennsylvania, although there's not much of a change there. I'll explain when we get to that. And maybe a few other things. Starting off over in Scotland, where the Glasgow hospital is not doing too well at the moment. A hospital in Glasgow, I should say. Doctors call for major incident as hospital unsafe. And this is happening at the Queen Elizabeth University Hospital, where they apparently just do not have room to take in any new patients. And I even saw down here documents seen by BBC Scotland News describe the whole hospital site at the QEUH in Glasgow as being completely overwhelmed. And then I also read down here that in one case, a patient had to wait almost 6 hours in the back of an ambulance with a fractured hip before they could even be seen or found a room. That is just totally ridiculous. There is definitely a healthcare capacity issue, not just in Scotland, not just in the UK, not just in Europe, but really all around the world. This is something that needs to be addressed. Are there some countries that are doing better? Yeah, there's a few, but that is few and far in between. Here in the United States, from time to time, we've been having hospital capacity issues as well at some hospitals. And speaking of hospitals, this is not good news whatsoever. Another one of those cases where, a group, a musician, a band has to cancel its tour, postpone a tour because someone has become sick. This time, it is the Goo Goo Dolls that had to cancel some shows in South Africa because John Resnick, who is one of the members of the band, is hospitalized with pneumonia. I really hope he has a full and speedy recovery. There's actually another article, which I don't have up, that actually shows a picture that he posted on Instagram. I believe it was Instagram, of him in the hospital. It's pretty serious, so this is not good. Obviously, Goo Goo Dolls, they're actually a great band, and I really hope they have a full and speedy recovery for him, and I hope they can get back out on tour at some point. Although, you know what? This day and age, with all these different viruses out there, it is really dangerous for these musicians to be on tour. I mean, it really is. I'm saying I hope they can get back out on tour, but quite frankly, to continue touring, this doesn't just go for them. This goes for any musician. It's really dangerous, and they are really putting themselves at risk of catching one of these viruses. We've seen so many. I've posted a ton of them on my website. Of course, I have missed some from early in the year where I was not documenting these cases. We're going to do a much better job of that next year, but it's been dozens that have already been posted this year. It's just totally insane how this just keeps happening, and no one seems concerned. Moving on now to New Zealand. In New Zealand, COVID-19 update, they had 1,719 new cases last week and 7 new deaths. And with that, there were 107 people in the hospital, and like always, they never know how many people were in the intensive care. The 7-day rolling average of new cases was 246. So, yep, COVID, it still exists over in New Zealand as well. Here in the United States, California reports 2 more human cases of H5N1 bird flu. Both are linked to dairy farms. And yeah, that number of human cases just continues to rise. It is not a good thing. Something else that is not a good thing, long COVID-19 weakens immunity in children and increases risk of infections. Yes, are your kids constantly getting sick? Have they had COVID? There could be your answer. And of course, right now we're seeing pneumonia. We just talked about a pneumonia case within the Goo Goo Dolls, but really, people of all ages are seeing pneumonia right now, or dealing with pneumonia. Not seeing it. They're feeling the effect of it because they are unfortunately getting pneumonia. It is really going up, and I'm seeing, so many postings on social media about children getting pneumonia. And I asked a family member the other day who was a teacher. My mom was a teacher for many, many years. I asked, when you were a teacher, do you recall kids being out for pneumonia? Didn't have an answer for that. Says, well, they could have been. I don't know. But the point I'm trying to get across here is, when you were in school back in the day, do you remember someone in your class being out sick with pneumonia? Put yes down below if you did and explain. If not, let me know down below. I'm sure maybe there was a case here and there. I'm seeing social media postings from teachers or people saying there are multiple people in the classroom, not just one, but multiple people at once out with pneumonia. My friends, that is not normal, and we should not try to normalize that and make it be, well, it happens. No, it doesn't happen. And it is not good to get sick again and again, and someone's going to comment right now down below and say, well, you need to get sick. It builds up your immune system. That's a bunch of hogwash. Getting sick again and again is not good for your immune system. It actually weakens your immune system. Yes, it can do that. All right, moving on. This study will make it over to my website, datareport.info. We'll archive it, and it'll probably be in the COVID in Kids Studies section. Not long COVID, because children, they have a section of their own, because COVID can really hit kids hard, and it can hit everybody hard of all ages. That's why we have a studies section, because let's face it, there's a lot of people out there who have had COVID, and now they're having these new issues, and they're going, what the heck is going on? Yeah, it could be you had COVID. All right, this is interesting. UK buys 5 million vaccine shots to prepare for H5N1 pandemic. Yeah, that's right. They are preparing in case it goes pandemic. And you know what? We really need to be doing this here in the United States as well in case it does happen, because this virus, H5N1, constantly keeps evolving, and at any given moment, it could turn pandemic. And, well, if we learned anything, we saw the child in Canada that was hospitalized for a month. I have not seen an update. He may still be hospitalized right now and in critical condition. Say you get a bunch of people doing that at once, yeah, that eats away at healthcare capacity. That is not a good thing whatsoever. Moving on to Billings, Montana, and in Billings, Montana, it's whooping cough that's the issue. So far this year, Yellowstone County, no, not Yellowstone National Park, but Yellowstone County in Montana, has experienced an increase in the number of pertussis, whooping cough cases, reported to public health officials at Riverstone Health. In 2024, Yellowstone County has so far confirmed 11 cases, compared to just one case between 2020 and 2023. 6 of those cases were diagnosed in November. That, my friends, is a pretty large increase, considering just one case over that period of 2020 to 2023. All right, I asked one of my questions yet again, and this time I asked in a poll question over on X. It is that time again. Do you know someone who is sick right now? They could be sick with any virus, even a cold. They did not bother to test to see if it's COVID or something else. Repost this if you can. Let's see how many know someone's sick. And at this time, the poll's over with, 74.1% of people said yes. 25.9% of people said no. That is out of 147 votes. So yeah, the vast majority said yes, they do know someone who is sick at this time. Reminder, my website once again is datareport.info, and you can find out a whole bunch of things there. And we do have a COVID studies and papers section, and of course the study you saw today, well, the headline I read about it, that study itself will be archived into the COVID in Kids section, which I'll be doing probably later today. All right, moving on now to air qualities. And yes, they're always a problem in the West Coast at this time of year. Why? Because, well, it is fireplace season. Sometimes wildfires can be the cause as well, but take a look here. You can see it here. It is red on the West Coast, and we do have some isolated bad air qualities in the East as well, and in the Great Lakes. Not certain what is going on in the Great Lakes. There are lake effect snow squalls going on up there. I don't know if that's impacting the air quality, but yeah, that's concerning to see all that orange up there in Michigan and near Detroit at this time. Who knows? Maybe it is fireplace time there as well. Want to learn more about the weather and the climate? Well, I have another place where I do that. Climate Data Report. I will be posting a video there later. I'm going to record a video for that after I'm done with this channel. All right, moving on now. In Philadelphia, on Tuesday, there were 780 EMS incidents reported, and on Monday, it was 775 EMS incidents reported, and oh my, I'm not liking what I'm seeing here. Okay, actually, this is better. A little bit ago, this was really high. This was Montgomery County, Pennsylvania, CAD, and it was up to 20 EMS calls, and as I was going to the tab, it still showed a long list, but does look like it has refreshed itself. That list has gone down to 13. Still a lot of calls, but better than 20 plus calls. And we do see cardiac emergency several times, and we also see nauseous and vomiting more than once as well. That's never a good thing. We're not seeing respiratory emergency call. That is a good thing. Now, over in Chester County, Pennsylvania, again, this is just outside of Philadelphia, we do see heart problems is listed twice, sick person, and stroke is a problem. Ooh, not good to see stroke. At least we're not seeing cardiac arrest, but stroke is never a good thing. Taking a look at hospital capacity across Pennsylvania, and we can see here it's generally the southeast portion, and some of the hospitals in the western portion of the state that even bother reporting. I don't know why central and northern Pennsylvania is just always great out here, but we do see some hospitals in southeast PA are showing up yellow. And remember, I showed you the other day, sometimes this is outdated information. This one is not, and it says Penn Medicine, Chester County Hospital. This is in Westchester, Pennsylvania, and it says high patient volume, 19 inpatient admission holds. Yikes, that just does not sound good. Up in Quakertown, Pennsylvania, yeah, this is today, emergency department at capacity, St. Luke's Upper Bucks campus. So if you're watching my video, and you're seeing this today, and you need to visit that hospital up there in Upper Bucks County in Quakertown, you may want to consider going somewhere else. There's a hospital just to your northwest, Lehigh Valley Hospital at Macungie. That's not having problems at this time. Maybe you'd be better off going there. And then if you head up into the Lehigh Valley, look at this. St. Luke's Hospital in Bethlehem. Emergency department is nearing capacity. And wow, here's another one. St. Luke's Anderson campus. There are just some real problems ongoing right now. St. Luke's Easton campus. And how about this one in Warren, which is western New Jersey, actually, at the moment. What's going on there? Emergency department nearing capacity. That's not a good thing. That's quite a few hospitals in that area right now that are nearing capacity. Take a look at wastewater in my state of Pennsylvania, and it says down here that you can't see it here, but it does say it updated. None of this says update on here. It shows that there is an increase ongoing in Chester County, Pennsylvania. Hey, we just happen to see a hospital there that's really busy at the moment. Not a good sign. In western Pennsylvania, we do have in Indiana County where a large decrease is happening, and then everywhere else in between is either just a slight decrease or holding steady or insufficient data. All right, Canada. COVID-19 is moderate at this time for your viral activity level. Flu A is low. Flu B is low. RSV is moderate at this time. Taking a look at what's going on with Walgreens. The national positivity rate is 13.3%. The prior week was 12.6%. Difference of up 0.7%. Total testing. It did not go up last week despite the holiday, people trying to be cautious for the holiday. Yeah, there was not a lot of that happening. People went on like it was pre-COVID. 3,696 people took a test. 4,323 people the previous week. So not a lot of people bothered to get tested. All right, let's take a look at some of these states. South Carolina. What is the deal here? You're showing up red. And it looks like a 7% increase in your positivity rate. It's 10% versus 3%. Total test, down. 80 versus 100. So it's likely because your testing's down. Your cases could be starting to go up, but your testing did go down. Florida, 6.9% positivity rate, 6.2% last week, up by 0.7%. Total tests, 364 versus 455. Your testing did go down. Texas, 9% positivity rate versus 8.8%, up by 0.3%. Total tests, 641 versus 809. Your testing did drop. Quick note, any of this data from Walgreens does not reflect the impact Thanksgiving had on the spread of COVID. We won't learn that till next week and maybe even the following week. So right now, that is not something that is factored into this data. Kansas, the positivity rate is 20%. The prior week is 13.6%. Difference of up 6.4%. Total testing down 35 versus 44. In Oklahoma, 12.2% positivity rate. The prior week is 10.2%. A difference of up 2.1%. Testing did go down. 49 versus 59. Making our way out to the West Coast now. Nevada. Nevada doesn't look like you have reported this. It says 0.0% positivity rate. 10 tests versus 12. I don't know if that's actually reliable. Arizona, 28.2% positivity rate. The prior week was 24.2%. Difference of up 4%. Total tests, 213 versus 281. Oregon has seen a positivity rate go up. Looks like they had 0 last week. It's 12.5% this week. 8 tests versus 12. Don't know what that's all about. Wyoming. Whoa, this is a significant increase. 27% positivity rate versus 12%. That is up by 15%. Total test, 74 versus 83. Testing's down, but even at that, with a positivity rate increase this big, you likely also saw some cases rise as well, and we should end on a better note. And here's a better note. Illinois' positivity trend, 14.7% versus 19.2%. That's down by 4.4%. Total tests, 251 versus 292. All right, let's take a look at some wastewater data, shall we? Nationally, here on Wastewater SCAN, COVID is coming up at medium at this time, and it does look like it's medium for the Northeast region and the Midwest region. And in the South and West, it is low at this time, and we're seeing northwest of Houston. What is going on there? We're seeing some medium show up. Let's click on it. And your COVID levels, they are starting to rise slightly. RSV, wow. That's a really high RSV level. Mind you, sometimes when I click on these wastewater sites when I'm doing this video, I didn't do it ahead of time. I mean, sometimes I will have already have looked at several wastewater sites, but if I see something that catches my eye, and I think, hey, we haven't checked this area in a while, let's just click on it. And then along comes this. RSV levels at Woodlands, Texas. This is northwest of Houston. 70,000 population. And look how high that RSV level is. I got to be honest with you. That is concerning. If you're in that area, please be careful. And if you can, try and get an RSV vaccination. Influenza A is low at this time. Influenza B is low. HMPV is low. Norovirus looks like you're seeing up. Then it goes back down. Then it goes up. Then it goes back down. Then it goes up. And now you're down again. You're seeing multiple waves. Look at this. 3 waves of norovirus within the last just a couple months. Yikes. That's not good. And we're not seeing any hepatitis A at this wastewater site. And Mpox is not being detected either. Let's check somewhere out on the West Coast now, shall we? And how about we come down to Los Angeles? This is a really big area, very highly populated area. So I want to know what's going on here. And look at this. LA, it's still low for COVID, but it's not really coming up. RSV's not being reported. Influenza A at this time is, it was rising, now it's dropping. That's good news. Influenza B, not showing up. Neither is HMPV. Norovirus, though it says not calculated, is on the rise at this time, and no Mpox issues in LA at this time. Alright, we do have a couple more things to look at. I wanted to show you emergency department visits with people diagnosed with COVID, but quite frankly, that would take this video way too long. And there'll be new data on that coming as we head towards the weekend. And because we did this midweek update, I think we'll be able to get that in on Saturday. Worst case, we'll do what we did last Saturday. We'll just go a full 30-minute video on Saturday. You can see COVID, it's growing in Indiana, likely growing in Massachusetts, Maryland, Michigan, Illinois, Iowa, Kansas, Arizona, Utah, and up in Idaho as well. And it is declining in 3 states. It is declining in South Carolina, North Carolina, and Vermont, and likely declining in a few states as well, and then not changing in a whole bunch of other states at this time. And well, when we take a look at epidemic trends for influenza, yeah, it's growing in more states than anything else listed on this map. All right, taking a look at this. This was a brand new update, and I need to refresh this. You will see here, there should be a new update, yes. Take a look at influenza-like activity. It is now, yeah, that is very high, showing up in Washington, D.C., and we are also seeing high levels now in Louisiana. We do have moderate levels in Georgia. We also have moderate levels in New Jersey, Texas, and it looks like also Arizona at this time, and then a lot of states just slipped to low as well. So it is definitely starting to pick up the pace, and it'll probably do so even more now that we just had Thanksgiving. Because remember, it's not all about just COVID. It's all the viruses, and all the viruses got a good mixing when it comes to Thanksgiving holiday. Everyone gathered around the table, and someone goes, cough, and they could be sick. You don't know. Or they could be like me that has coughing fits constantly, and it's not an infected disease, and it's long COVID. Who knows? But, yeah, influenza-like activity is now starting to rise. Taking a look in New York State, 465 people tested positive on the new update. Taking a look at hospitalizations, yes, they did see a rise this week, though today is down over yesterday. 452 people hospitalized, and patients in the ICU, 62. But I should say this. It looks to me like the rise that is starting in New York State is not as fast as the rise they saw last year around this time, and I think it is starting a little bit later than last year. That is good news. Alrighty, folks, that does it for the Wednesday edition of the virus update. Oh, we forgot to do one thing. We forgot to check on New Jersey. Their dashboard has not been updating for some reason. I'm going to take a look at it later on. Maybe it's finally updated. I had stopped even bother refreshing that page, but it does look like they do have JFK University Medical Hospital. It looks like they have a patient volume issue in the ER, and anything else here is just not full diverts at this time. That's good news. Alrighty, folks, that does it for the Wednesday virus update. If you enjoyed this update, give it a thumbs up. Want to see more content like this? Subscribe down below. Want to keep other people safe and informed? Easy way to do that. Hit that share button. Post this on social media, Facebook, Instagram, X, Blue Sky. All these different social media places. Post it there. Share this with other people and say, hey, there's someone out there that is reporting on these viruses and telling us what's going on. It really helps me inform more people, because that's really what it's all about. I want to keep you safe and informed. So subscribe, like, do that, and of course hit the notification bell and leave any comments down below. I will see you all again next time, which as of right now is looking to be Saturday. Until I see you again on Saturday, stay safe everyone, and have a fantastic Wednesday afternoon. Thanks for watching.